and welcome everybody to the PEP seminar, Partnership Enhancement Program. This is Strategies for Patient Empowerment and Advocacy Know-How, also known as SPEAK, because the foundation loves an acronym. My name is Mel Lawrence. I am an adult living with CF, and I am joined today with two amazing human beings. I'll allow them to introduce themselves. I'll pass it over to Carol Chase. Carol, do you want to introduce yourself?
Sure, thanks, Mel. I'm Carol Chase. I'm a social worker at Children's Hospital in Washington, D.C.
And
And
Karen?
And I'm Karen Von Berg. I'm a physical therapist with both our pediatric and adult programs at Johns Hopkins in Maryland. And along with Carol, we are two of a handful of facilitators in the Partnership Enhancement Program, in addition to our clinical roles with our individual teams.
Thank you both. Just to give everybody a heads up, there is a pre-session survey in the chat. I know there's been a little issue with the link, so Laura, thank you for posting the extended link. And just a few quick housekeeping items. This session is being recorded and will be available after the event on the CF Foundation's YouTube channel. It is meant to be interactive. We don't want to be talking at you. We want to be talking with you. So we're encouraging chat discussion in the chat box. We're taking questions and answers toward the end. You can post your questions under the Q&A tab. And we will also be having options to hear your opinion via Mentimeter. We want to hear what your thoughts are as we move through this presentation. We encourage you to submit your questions again in the Q&A box on the right. And before we begin, just a quick reminder about our code of conduct. Please be considerate, open-minded, and respectful. We also ask that you do not ask or give any medical advice, and please visit the help desk if you need any staff support. Moving on to our agenda for today. We're just going to go through a very brief history of the PEP program, how it started and how we got here, the skills that we've been learning in PEP, preparing for our visits, sharing your perspectives, understanding before you go, and then we'll have our Q&A toward the end. And I'm going to pass the baton to my dear friend Carol, who's going to walk us through how we got here. Carol?
thanks, Mel. So we wanted to let you know that the Cystic Fibrosis Foundation actually conducted research with individuals living with CF like you and their care teams. And we found out that they wanted to improve communication, especially around difficult conversations. And the illustrations that we put on the slide today really makes it feel like we're speaking past one another and that we're really not speaking to one another and connecting on the issues that are important to you. So physical and emotional help, the social and economic challenges of living with cystic fibrosis, preparation maybe for moving into adulthood and having other care team members added to yours, and sustaining treatments that you are already trying to do to stay healthy. And so the foundation put together a program with the Academy of Communications and Healthcare program specifically designed to teach individuals about relationship communications. And Karen and I, as well as several others, I think there's probably 23 of us now, who learned these skills, went out to care centers around the country and taught care team members how to improve communications with individuals who are living with CF. And this is the group of us that you see on the staircase who put this together and did some traveling. And then we moved into why. How come relationship-centered communications? And what we found was that there actually can be improved health outcomes for our patients. There's an improved satisfaction with the professionals that are caring for those patients. And then certainly there's improved satisfaction scores, which matters to all of your care teams. So from there, our mission was PEP was to improve communications. And we wanted to show this illustration so that we're understanding perspectives of the care teams and individuals who are living with CF. And if you look on the left here, this is what a care team member, maybe your physician, maybe your nurse practitioner, might write in a medical record about the care they're asking you to do on a daily basis. And on the right is an actual list from a patient living with cystic fibrosis who enacted this treatment plan in their daily life. And so really looking at this and helping the care teams understand what this looks like for you at home and how you integrate this into your life was really important. And it really opened up the eyes of a lot of care team members who hadn't really thought about this perspective. So next, it's another way to take a look at perspective. The image on the left shows someone's actual day, their life, right? They have, if you imagine all of these dots being some part of them, so your spirit, your employment, your fun, your family, your extended family, your healthcare issues, your travel, your vacations, right? All of this makes a really colorful, vibrant life of a person. But when you come to your care center, what's in the middle is what your care team might see. And that would be cystic fibrosis, right? So the care teams were really missing who you are as a person, as an individual. And if you look on the right, many care team members think that your life is centered around cystic fibrosis, which, of course, if you sit back and think about it, is ridiculous. But you'd be surprised the number of folks who think that way when you walk into the clinic. So the PEP skills for clinicians were really about helping clinicians meet with patients in the clinic and make a partnership. And we taught them to do this by establishing trust with their patient, creating an open dialogue that goes back and forth instead of in one direction, and then setting goals by partnering with you to reach those clinical goals. And we did that by addressing what's most important to CF, to individuals with CF and their families, and getting a greater understanding of the perspective of the individual who's in the clinic, and then engaging in a stronger collaboration, right? Helping put together a plan that's going to work for both sides in the appointment. Oop. Sorry, having pop-ups here on my screen. So what we thought today we would do is sort of flip this around now using these PEP skills to help you going into that care team and teaching you some of these same relationship communication skills that we taught the care team so that you feel more confident and being able to advocate for yourself when you go into that meeting. And so what we thought we would do is help some of you put together a list of questions, sort of an agenda when you go to see your care team, help you share those expectations that you want out of that particular interaction, and ensure the understanding of the action plan moving forward. And one of the reasons we thought this was so important to bring to you today is that so many of you have just moved beyond your CF care team now and have so many other clinicians who need to hear from you. And you have the best perspective of yourself. And that's what we want you to be able to share with others, is your knowledge that you already have, and in a way that new providers might hear that from you. So one of the ways that we have encouraged folks to go into a meeting with a new provider is by coming in with an agenda, right? Having an idea of what it is you want them to know, what it is you want to share. And this is an example from the Johns Hopkins program about agenda setting in their clinic. And we wonder if you would take a look at the Mentimeter and let us know if your clinic uses agenda setting. And we'll give you a few minutes to pull up your agenda. Wow. Doesn't appear
And I
that
just want to
you have that agenda set.
I just want to point out, it may not be a piece of paper that's handed out. It could be an electronic survey that is sent prior to the visit, or it could be a discussion that happens when you arrive at your visit. So there are multiple ways that agenda setting can happen.
It appears still that may not be a thing. Okay, well, we appreciate your answers.
It's a good thing that we're doing this today then, right?
Yeah,
so they can
absolutely.
work on their agenda setting.
Absolutely. And I wonder if we might take a minute to think about what is maybe the benefits of setting up an agenda in the clinic. Maybe folks can try putting some words in the absolutely meeting your needs as a patient. Beautiful. In the chat, we have managing the time the team has to get what you want. Beautiful. I agree with that wholeheartedly. Makes your whole meeting succinct for everybody. And so that you don't forget your questions while you're in the appointment. Beautiful. Yep. Mel, you can feel free to chime in here too.
Yeah, I feel you, Crystal, 1,000%. At 45, my memory is far from what it used to be. So I find that keeping a notes app, like between appointments, I'll open my notes app and I'll write down like bullet points of things I want to talk about at my next clinic visit so that I can remember when I'm there. And also for me, my team, it is so much easier to address things right then and there than to try to track down my team after the fact via email or, paging or the patient portal where the records are. So I love keeping a notes app, setting my agenda, making sure all of my concerns are addressed. And I think ideally for centers that do use agenda setting, if they do it before the clinic visit, that's like the ultimate dream, and where we can submit our questions ahead of time, and then it helps the team prepare to answer them the best they can. So absolutely, I see so many benefits to agenda setting.
Yeah, I like that you said that, Mel, that it helps the team to prepare, because if it's completed before or even at the very beginning of the visit, if you share, like, I want to see this person and that person today, it really helps the team to prepare, because maybe, myself as a physical therapist, I wasn't planning on seeing you this visit because you're not due for your annual visit. But if you have questions that I can help with, then it helps me to plan out my time so that we don't miss each other on that day. And just while I'm on mic here, I just want to point out that we will be using the Mentimeters throughout the session. So if you haven't seen where to find those questions yet when they pop up on the screen, Over to the right, where you see chat and Q&A, there's also the tab for Mentimeter. So the next time a Mentimeter question pops up, you can click on that tab and be able to respond to it there. All right. Pass it
Thanks,
back to you,
Karen.
Carol.
And Trisha added that it reduces overwhelming feelings and creates a collaborative vibe in the clinic. Love that. That is such an important point. I think that feeling of overwhelming when you meet a new somebody on your care team. Um, and maybe these are a few ideas from us that we have used today to sort of prompt you about what kinds of things you might add to your agenda. And certainly, I'm sure all of you can add to this, depending on which care provider you're going to see. Um, but we wanted to just give you some ideas today of things that we've collected along the way. And then there are other things that you can address when you agenda set, right? Sharing your concerns about going into an appointment and helping people understand what's really important to you is also part of our thoughts for you today in meeting with that new care team member. Why are you there? What is it that you want them to know about you? And sort of making notes to yourself so that you can reach the individual person that you're hoping to see, like Karen was saying earlier. And then, Karen, is this you at this point?
This is me. And I just want to know, I think we have the pre-session survey working, which Laura just added to the upper left-hand corner of, right above the slide there. So if you want to take a minute, it shouldn't take you more than 2 minutes to click on that. I think I'll just pause before we move on. If you guys can take a minute or two to complete that survey, and that way you can focus on that, and then we'll move on with the slides.
Good idea.
Looks like that link is working. I am on my end, I'm able to see some responses coming in. So thank you, everyone, for completing that. And thank you, Crystal, for letting us know, because I think you were one of the ones that was having trouble earlier. So definitely appreciate that you can get through now. Okay, I think I'll go ahead and move on so that we stay on track with time. So picture yourself at a CF clinic visit or at a visit with a new to you specialist, and imagine a table between you and the physician, nurse practitioner, therapist, whoever it may be. And on that table, imagine putting different books of your story. So we're encouraging you to put your story on the table so that the provider can get to know you And your story is made up of many different books, just like Carol shared a few slides ago, all those different colored dots. There's so much that makes up you, that makes up me, that makes up Mel. And, we're all unique individuals, and we want to make sure that we get to know you as a person. One book is your symptom story, right? And quite often you're asked about this story. Probably a visit doesn't go by where you're not asked about your symptoms, your cough, your appetite, your exercise tolerance. That's an easy one to put out on the table. But what about your other stories, your personal story? So, for example, how treatments may affect your day-to-day activities, or your emotional story, maybe how the financial burden of copays is making you feel from an emotional standpoint. And before we dig into this a little bit more, we'd like to hear from you. So another Mentimeter. So again, click on that tab so you can answer and we can see how everybody feels about this. Do you see value in sharing your personal and emotional stories? Yeah, and Crystal, yes, it can be frustrating if you have something, your biggest concern, and it gets brushed aside. So important to get it out there, and
And I
hopefully
wanted
it gets
to share,
addressed.
Crystal, we're going to help you with some language that you can go back and address that biggest concern, because this is exactly why we're here. We want you to be heard, and we want the care team members that you're seeing to acknowledge that they hear you. So thanks for bringing that up.
Right. So it looks like overall people see value in sharing the personal and emotional stories. So why share personal and emotional stories? Mel, do you have an example of maybe when you've shared a personal and emotional story that you're comfortable sharing with everyone?
Yeah, absolutely. I share probably too much about myself with my care team. We have a very open communication style where we learn about one another. But for me, one of the biggest, most pivotal things to share with my care team is one, I believe like that our personal lives and emotional lives do affect our health. So while we might compartmentalize and think that like this is CF, I'm here to talk about CF, my emotional stuff doesn't matter. I think it absolutely does. And my emotional like stories that I've told my team has absolutely impacted my health. One of which being that I'm a single mom to a 14-year-old son who's the absolute love of my life. And I wouldn't change a thing. But also, I have no family support when I get sick. I have amazing friends who are all very busy with their own lives. And on top of all of that, my son is very active. He lives a busy life. And I'm my mother's primary caretaker who has cancer and early stage dementia. So my plates are very, very full. And so for that reason, it's really hard for me to go into the hospital inpatient. And so sharing my story and my outside life with my care team, they empathize with it and they will bend over backwards to help me avoid like hospital stays at all costs. And like for that, I am so, so grateful. It has been like a lifesaver.
Thank you for sharing that with us, Mel. That makes such a big difference for the team to know when you have all those other things going on. And really, it helps us to see all of you. So that's good that you are sharing those things with your team. And thank you for sharing with us as well. So, some categories to think about when sharing your personal and emotional story. There are different things that you can think about. Impact. How does this impact your day? Different ideas you may have. You are the expert in your care. You know your body, your personal life, everything else you have going on, all those different colored dots, all the chapters of all your books. way better than anyone else does. So your ideas matter so much. Your expectations for the visit or for changing treatments or seeing specialists, it's important to share those things as well. Because again, you know you best. And then sharing your emotional impact also. So these are just some different buckets, if you will, to think about different ways that you can share your personal or emotional story. And I have some examples of each on the following slides. So, for example, a way to share how things impact you. There are a lot of things going on in my life right now that will make finding time for extra treatments a challenge. Can we talk about some of the risks and benefits of what you recommend to help me make an informed decision? So, like maybe adding a new treatment into that schedule that Carol shared that already has all those highlighted lines really aren't ideal for now. But, like, what are the risks and benefits and how can we go about it? Different ideas. The last time I was sick, this medication gave me some not so great side effects. Can we try something different this time? We think about expectations. It may sound like I've been starting to think about getting a job after college. I'd like to talk with someone today about how to discuss CF with potential employers. And then emotional impact. I've been anxious about the blood work. Can we do that first before talking about anything else? So again, just some ways that you can think about how or why it's important to share your personal and emotional stories with your care team. Moving on to the next section in our session today is about information sharing. And at any visit you go to, whether it's a CF clinic visit or with a new specialist, information is going to be shared. It may be about a medication, an exercise plan, CF related diabetes, or needing to get a colonoscopy. And sometimes, as clinicians, we can get a little bit overexcited to share all the information we know. And unfortunately, it comes across as a big download of information or a big dump of information to that person sitting across the table from us. So, Carol, can you give us an example of what a download may sound like?
I sure can. So, individuals with CF have a much higher risk of developing colorectal cancer at a younger age. So, it's extremely important to get a colonoscopy when you turn 40 and then every 5 years afterwards. You'll have to schedule an appointment with your GI doctor, and then they will tell you how to schedule the colonoscopy. The thick, sticky mucus that's in your lungs is also in your colon. So, you have to do an intense preparation before the colonoscopy. It's different than the prep that people without CF must do. So make sure you read the information in the handout and follow the steps exactly. Otherwise, you might have to do a second procedure.
Ooh, that was a lot. So that was a download of information for sure, especially if this is the first time you're hearing about a colonoscopy. So if you can go to the Mentimeter tab on the right and fill out what do you remember about what Carol said? Did you get all that? Age 40, every 5 years, the number stood out. Listen to instructions. Prep is more intensive, higher risk. So we got some bits and pieces. And I'm going to just side note, I really like the different colors popping up on this word cloud. Usually it shows up as one color. I'm appreciating the colors right now. It's the little things in life. We also see in the comments, follow the directions exactly, talk to another doctor. So it was a lot of information. We can go ahead and move on to the next slide, Laura. This is everything that was said. And again, unfortunately, whether it's trying to be super efficient because we only have so much time, or just because we're excited to share everything that's in our heads and make sure we tell you everything, it comes across, like I said, as that big dump of information. And one of the things we teach clinicians when we do the full PEP workshop is to avoid doing this. And this is probably coming up one of my favorite slides ever. I love this analogy. Again, it's the little things in life. If you were to come over to my house and wanted some pineapple, I wouldn't expect you to just eat the whole pineapple. I would take the time to first cut it up into chunks, right? And the same is true for the sharing of information. We as clinicians aim to chunk information into digestible pieces, kind of find out what you know first and then go from there. And unfortunately, that doesn't always happen. Like I said, we may be rushed for time, or we just want to make sure we tell you everything. So if you feel information has been dumped or downloaded on you, you should feel empowered to slow the conversation down, press pause, ask for information in smaller chunks. So, Mel, can we pretend Carol just downloaded all that information about colonoscopies to you, and you two can demonstrate that conversation?
Absolutely.
And we have it on this.
Okay, so Carol, you're my provider. And I would say to you, this is all new information to me. I didn't think I had to get a colonoscopy till I was 45 or 50. That's what someone else had told me.
Yeah, Mel, I can understand. People with CF have an increased risk of colorectal cancer and at a younger age compared to people without CF. So, for most individuals living with this disease, it's recommended you get your first colonoscopy at age 40.
Wait a second. I saw a commercial on TV about a prep that you can do at home. I'd so much rather do that than the real procedure.
Yeah, you are not alone. Most people prefer to do that. However, that test is shown to not be as great in persons living with CF, and unfortunately, a colonoscopy is still the best way to detect polyps. You'll need to see your GI doctor to get it scheduled.
But I do remember you saying something about an intense preparation, which sounds like not very fun. What is involved in that intense preparation?
So we'll time out there, but hopefully you kind of get the idea of the download has now become a dialogue. Instead of just one way dumping the information, it's now a back and forth conversation. And it sounds as if Carol and Mel are actually hearing information. The information isn't getting lost or going in one ear or out the other. And I'm seeing Becca comment, it must be hard to be a CF provider because patients have such variable knowledge levels. Yes. So there is no one size fits all when it comes to sharing information, but I wouldn't say that makes it hard. It just takes a little bit more intentionality on our part. And Carol would maybe start with, Mel, what have you heard about colonoscopies? And that way Carol finds out Mel's like baseline level, and the conversation can roll from there. So getting that, kind of that baseline check in there can really help us as providers to know how to go about sharing information. It's happened to me multiple times. What have you heard about the importance of exercise for bone health? And then people can share, what they know. And I may not need to teach anything that day because they're already aware of the types of exercises they should be doing to improve bone health. So yeah, it's just about slowing down, being intentional, and being curious for us as clinicians. And I would encourage you all, I mean, the point of this today is really to help empower you that, for those clinicians who aren't being curious and intentional and slowing things down, that hopefully you have some ways to see that like this is possible. You shouldn't leave the visit feeling like, your head is a helium balloon and just floating up there because you didn't quite get everything. So hopefully we give you some prompts, some tools to help with that. So, and I see you're already working on the Mentimeter here. Thank you. What would you say if you feel information was downloaded on you? So again, you can get to that Mentimeter over on the right-hand side of the screen. And we just put up some different prompts there that you can pick which one resonates with you. Yep, Trisha, your different backgrounds, what you have going on that day, so much can impact how much you can process and take in one visit, especially a CF visit. I mean, we're kind of a big multidisciplinary team, and I imagine it can be overwhelming to have a number of people going in. So people are liking, can you repeat that last part again? And do you have a handout with that information? Yes, getting it written. Getting it written can be helpful. I would nod my head and pretend I got it all. I was hoping no one would select that one. Hopefully after today, you don't do that anymore. Okay, we'll move on. Again, liking the colors there. Okay, ensuring understanding and taking next steps. So let's talk a little bit more about making sure you understand. As I shared, a lot of information can be shared, whether it's that multidisciplinary CF visit or you're seeing a brand new specialist, such as a rheumatologist or a cardiologist, and the nerves may be a little bit heightened because you don't have that familiar relationship. At the end of the visit, it can be super helpful to do a recap and make sure you and the provider are on the same page when it comes to any education that was provided, any medication changes, and next steps. What's the plan when you walk out of that office? And while we definitely encourage you to do this at the end of a visit, as you just heard in that interaction between Mel and Carol, it really can be done at any other point during the visit as well. So on the next slide, we have some suggestions for how you can do this, whether it's mid-visit and information is being shared, or it's at the end of the visit. And also, there are some resources. Again, you can find them over to the right in the docs, DOCS, that you can download afterwards that have some of these prompts on there. So some things that you may say, even just questioning it. I talked about us as clinicians needing to be curious, but you need to be curious as well. Why is this change being made? Don't just take our word for it that it's something you need to do. Stay curious. Make sure you understand all of it. Or, if there was a lot going on that day, we made a lot of changes. Can you make sure it's all in the summary I get in my chart or gets printed or whatever your clinic does for information sharing? Maybe they didn't get to everything on your list. Maybe agenda setting wasn't done and there were things that you wanted to talk about. So at the end, it may sound like we spent a lot of time on my weight today. Next time, can we plan to talk about genetics and fertility if you're interested in family planning? So again, getting that plan so that both the team or specialist and you are on the same page so you can better partner to get you the best care possible. Asking the question, I know it's happened to me at visits I go to. You just feel like you're being rushed out the door. They need to get to their next appointment. And taking that pause to say, would you mind if I recap what we talked about today to make sure I am remembering everything? Or before you leave, can I just double check my list and make sure we covered them all? So lots of different ways. And there are dozens and dozens more, but we just put a few up here to help to get you thinking about different ways that you can really partner better with that healthcare provider that's on the other side of the table from you. And just to recap here, so we make sure we leave time for Q&A before our session ends. These are the high-level overview of the skills that you can use for self-advocacy and better partnership with any healthcare provider. And I will add in, these skills also work in any conversation that you have. I like to use these skills when I'm talking with my teenagers because they don't like to share a lot of information. So naming emotions can be really big, or making sure we're on the same page about, what time they need to come home. But back to PEP for healthcare conversations. Please tell us what matters to you. If your team does not tend to do agenda setting, take the time before you go to the visit to think through, okay, what do I want to accomplish in this visit, and jot them down, because you never know what may come up between now and the time you get to the visit. You could have more dots than usual on your plate that day. So writing them down, as Mel shared, she uses the Notes app. So just that you remember, and you can share with the team both who you'd like to see that day and what questions you need answered. Share your perspectives and emotions. You are more than your CF. You're more than that yellow dot, and you are more than just your symptoms. We want to know what's going on in your personal life. How are you feeling about all of this? Because it truly helps us partner better with you. And then last but not least, the third chunk is creating and confirming a shared care plan together. So making sure you understand the information that's been shared with you, and that you and your provider are on the same page as far as what are the next steps moving forward. So that will, I think, take us into Q&A. And I just want to also point out, we had the pre-survey. If you didn't get a chance to do that yet, you can still do that now. And we also have a post survey that hopefully will work, that Laura will share, that she's either going to drop in the chat or put in the upper left-hand corner. So keep an eye on that. And there it is in the chat there. If you want to take a minute to click on that, whether or not you complete it now is up to you, but at least open up that link so you have it to complete afterwards. And I'll pass it back to you, Mel.
Thanks, Karen. So just a friendly reminder, there is a Q&A tab next to the, it goes in near the chat box. It says chat polls Q&A. Please feel free to enter any questions there. We'll be happy to take any and all questions. Ask us anything. And while we wait for the questions to roll in, I will just share a very quick real life example about a colonoscopy I had and a download that was overwhelming. So my first colonoscopy, I waited too long. So PSA, get your colonoscopies. I did it beyond 40 and it was abnormal. And when the doctor called to give me the results, as soon as I heard adenoma, I stopped listening to everything else. And so I had to use the PEP skills and be like, wait, hold on a second, slow down. Can you go over that? And a bit slower. So that's a real life example of the PEP skills. And hi, Trisha, in the chat. We have a question. It's just, I have a provider in which I assert my concerns over progression of one of my diseases. She doesn't take it too seriously. Then I wrote to her twice on my chart, and after seeing my last labs, she finally took what I was saying seriously. At what point, after advocating for yourself, do you ask to change providers if there isn't much trust there? That's a good question. I know what I think, but I'm going to defer to the professionals.
Well, you know what, Trish? I don't know how comfortable you are speaking with this provider and letting them know that you're not feeling heard, that your questions aren't being answered. That's where I might start. If you have someone else on the care team that you could engage in helping you have this conversation with this provider, I personally don't think there is anything wrong with getting a second opinion always, right? It doesn't mean that that second opinion person will hear you any differently. But I think if you're wondering about that, there's never a bad time to get someone else's opinion. So I wonder if the skills that we helped you today would make you emboldened enough to sort of go back to this individual and say, I really need to be taken seriously on this, and I feel like I'm not. And I wonder if we can have another conversation.
I love that you mentioned trust because that is so important in being able to partner and have these conversations. And Mel, I know you are very invested in this as well. So I think it is important for you to share your opinion here as well.
I also love the trust in there. And I think, yes, it is so important that we trust our clinicians, but it's also equally important that we trust ourselves and we trust that gut feeling that this might not be a good match. Mm-hmm. And I think Carol has a good point to give her or him the benefit of the doubt and a second chance by addressing it and saying, I'm having an issue with this. This is how I feel. But also, I see a rheumatologist, and I tried 3 different rheumatologists before I found one that would actually listen to me. So it's okay. You are in charge of your healthcare, and you should trust your clinicians.
Mel, I wonder if you saw too in the chat, someone, Crystal, was speaking about going to a GI doc and was saying that she was feeling like she needed to speak to the GI doc why CF was so important. Can you speak about maybe with your experiences with the rheumatologist or some other provider that you went to that you felt like you knew more than maybe the provider did about living with CF, and how did you manage that?
Often. It happens so often. And I hear it from the community members all the time that we're getting older, we're seeing more specialists, and seeing a new specialist does feel like the tables are turned and we're educating them. I went to see a new hematologist this week, and she was amazing, and I loved her so much. But she said to me, and I love that she said this, "You're my first patient with CF." And she wasn't saying it in a way that was like I needed to educate her. She actually said it in a way that she was excited by the challenge, which was comforting to me. Like, all right, she's in this with me. We're going to be working together. But I do think that these skills are so important in self-advocacy and just owning our feelings and our experience in healthcare, no matter who the specialist is. And I did see Holly just wrote something in the chat that she had good doctors over the years, but there's one particular doc that she had to fire. I love that, Holly. I went back years later and decided to give him a second chance, but the experience was the same as the first. It is okay to move on if a doc isn't a good fit for you. I agree, Holly, and that is well said. And I love that you gave the doctor a second chance.
I think that one of the things that we talk about on the care team is CF isn't just CF, right? Every individual's experience of CF is different. You may have the same mutations as the next guy, but you don't present the same medical issues that the first patient showed up with. So again, I think you have to be able to find providers that you can communicate with. They hear you, you hear them, you get your needs met. And that's what I heard you say, Mel, about the hematologist and especially about your rheumatologist. You just kind of had to keep looking till you found the right one.
Yeah, absolutely. And to that point, Carol, I'm the same person with the same CF my whole life, But through my 45 years, the disease has changed. I have changed as a human being. My experience has changed. And there's a lot of turnover within healthcare. So my providers have changed. Like, things are always fluidly changing. And so to have the foundation of self-trust and self-advocacy can help you no matter what the situation.
And I, sort of taking back what you and Karen were saying about trust and partnership, I think that changes along the road too, right? Like, you're doing okay with this provider, and then somebody new comes along and you like them more, right? Like, okay, so work with them, right? I think from a clinician perspective, I'll say I don't really care who you go to as long as you can get the care that you need and you deserve.
Carol, I could also add, like, as far as trust goes, like there could be those wobbly moments even with someone you trust, right?
Yeah.
You could have been seeing someone for years, and maybe me as your PT on the team, maybe I'm having a bad day and I come across grumpy and it rubs you the wrong way because you're having a bad day also, and things could just fizzle from there. So yeah, it's this like constant give and take back and forth, and the more that we can be open with each other and share how we're feeling, share how something affected us, then hopefully that helps to build back that trust if those wobbly moments have happened.
Yeah. We're all human, right?
Like we sure are.
Sometimes patients don't feel well, and so we're not seeing them at their best. And like Karen said, your care team members are coming in with experiences from home and stressors from home that we're unaware of too. So yeah, I think these skills bring the humanity back into the discussion of healthcare. There are a couple
Yeah,
more
I was just going to say we have more questions.
Go ahead, Mel.
Good.
Okay. Joanna said, "Hi, Karen. My last clinic visit, my doctor told me that if I grew aspergillus, he would not just do a CT and wait a year, or he would. Okay, sorry, Joanna, I'm doing you a disservice here. And then do a comparison. It worried me as a quick search shows that if we grow aspergillus, it is recommended to treat it. I just had to ask to do an annual review sputum, which started the whole narrative. How can I challenge this without making them dislike me, as they really like talking about CF and what they know?" Joanna, that I'm going to let Karen 1,000%, but I think that you touch on something so significant in CF clinical care, and that is like, we do care what they think about us as a patient. And it's so funny because in my regular life, I don't care what people think about me, but I need my CF team to see me as a compliant, trustworthy patient. So that strikes a chord with me. And I'm sorry, Karen, I'll let you answer.
No, I think that's super important to know, and also really sweet, because I don't think I always think of that as a clinician, that like the people coming in to see me really care what I think. I don't know. I do care about them. I care about my patients so much, and I'm going to get teary-eyed here. I think, Joanna, exactly what you said there. It worried me. That's sharing the emotion, right? And I think naming that, I'm worried that you're not going to do X, Y, and Z because I thought this, or whatever it may be. But I think when you add in that emotion, it kind of softens the what's the word I'm looking for? The confrontational aspect of it. Not if the doctor's saying you need to do this and you come back and say, no, I need to do that. It can come across as confrontational, or that you may be angry with that provider or whatever, but really you're worried, you're scared. And I think that's where naming the emotions is important. And I see we have another.
Yes.
At least one other one in there.
I think we have time for one more. And then sadly, we'll have to wrap. But Mark said that he's noticed trouble with the processes and transactions, like getting prescriptions, insurance approvals, and paperwork is a huge issue at his center. Do you have any suggestions for how we can do that, effectively challenge that without having the patient-provider clinical team relationship break down completely? Great question.
I have a thought I'll share quickly and then let Carol or Mel weigh in also. I think that's where, if you think about it from a curiosity standpoint, right? Instead of just getting frustrated because you're doing the same thing, you're doing the things you think you should do. I would say maybe ask the team, what is the best way that I should do this? How would this work for you? I know I do that when I talk with patients. You know, if they want me to check in with them in a couple of weeks, what is the best way for me to check in with you? Should I send a my chart? Do you want me to call? Should we set up a video visit? And that way I know that hopefully they'll answer my message. But not everyone checks their, their medical record, their messages that way. So I think being curious about it. Okay, this hasn't worked. Let me try a different way. But instead of just trying these different things, asking the team, how should I go about doing this to make sure it gets answered? Carol, Mel, what else?
I love that. I think also I could suggest back to that agenda setting that you ask, many clinics have a pharmacist on the clinical team who are responsible for helping get those insurance approvals. And they don't always get to meet patients face to face, but those are the ones who do it for you. and and then you could also ask to speak with the nursing team. Sometimes they have specific nurses in the clinic who are responsible for the paperwork kind of stuff. So keeping that on your agenda and letting the clinical team know, like, this continues to be an issue for you. There's got to be an easier way. Can we talk about this? It really does take an extraordinary amount of time.
And I don't think clinicians like it either. I think it's the crux of most clinic visits. I would say find an ally on the care team, somebody that you can be your point person when you're super frustrated, and be like, even if they can't help you, they can help connect you in a way that, like, this patient's frustrated and hitting a wall. How can we help them?
Yeah.
And with that, our time is sadly coming to an end. So we wanted to share some resources that are on the Docs tab, which is right in between the Q&A tab and the Mentimeter tab. This will always also be emailed in the post-session wrap-up. So the one handout is the skill sets with just bullet point tips and tricks on how to communicate better. There's a handout for specific prompts to get the conversation rolling. And there's also a document on navigating a new medical practice. We all are having so many specialists now and meeting new providers left and right. So this is really good to help us go in with an agenda and make sure that everything is addressed. And then I just want to give a big thank you to everyone for attending. These housekeeping before you go, please fill out the satisfaction poll under the poll tab, which is right in between the chat and the Q&A. I know we're asking a lot of you today. Thank you so much for attending. Thank you, Carol and Karen, for all of this useful information and for helping to get it out there so beautifully. And thank you to Carrie and Laura for being our behind-the-scenes tech support and helping this all come together. It takes a village, y'all. So thank you so much and have a great rest of BreatheCon.